Hello, everyone. This is Dr. Khan. So I have a wonderful patient. She is 3 weeks and 2 days out from her surgery. She is doing very well. She is 78 years of age, 78, and you look and basically as far as your recovery, the way you were prepared, I was very amazed, how well prepared you were, and you're not too far from here, almost 45 minutes to an hour. Now let me ask you this. You got implants in 2013, and this was 12 years ago, and 260cc implants. Now when your implants were returned to you, you thought they were saline, but silicone is what I removed. So this is why I returned the implants to the patient, so that you know exactly what was inside, because you were certain that you had what were saline implants. Now, the next thing is, I want to mention that your plastic surgeon was an amazing surgeon, because he made my life very easy when he did the surgery. He did it perfectly right. And when I removed the implants, you can see an aesthetic result in someone 77. Clearly, you did not need drains, as you see. And let me ask you this. Do you think you needed a lift?
Not well, I would have liked, but what now, looking at it, no, I don't think
Yeah,
so.
absolutely. And you remember, you're just 3 weeks out. You're still going to settle. And I will say, as a plastic surgeon, a lift on you for someone 78 would absolutely be an exaggerated, uncalled for, unnecessary operation. And I'm very pleased with where you are at this stage, and we'll see where you're going to be a year and a half out. And absolutely, clearly, you did not need a lift. Now, let me ask you this. When did you know that you had to get the implants removed and not replaced?
Early in March, it was like Breast Awareness Day. Someone posted on Facebook the signs, all the signs and symptoms of breast illness, breast implant illness. And I looked at it and I thought, oh my goodness, that's me, because I had just gone to my doctor and I had told her that I felt my whole body had inflammation. My hands, my feet, my dry mouth, my dry eyes, and I was having all these difficulties, and I just a shortness of breath with exercise. And I thought, oh, that's what's causing it. I immediately at that moment researched and looked up the names, and I found Dr. Khan's name, who was near me, and I called and made the appointment right there and then. And then as soon as I could get in, I came alone. I had made up my mind they were going to be out even before I came in here. And I had one appointment, and I left, paid my deposit, had the date, and it was a done deal.
Wow, that was your determined lady. So, and very, I use the word strong-willed. So you knew exactly. How sure were you that this surgery was going to help you?
Well, I wasn't sure, but I figured if it didn't help, at least I've eliminated the reason for all of this. But I felt there was no way I could get any solution to these problems without them being gone. I thought I had saline implants, but obviously I didn't. And I just knew that this would, at least there was one thing that would be gone from my body. If they were toxic, they would be gone. And I just decided then and there. In fact, I didn't even tell my husband about it till after I made the appointment and made the decision to have them out.
Mm-hmm. Now, a question for you. What research did you do in order to make the determination that this was it? Because, had you gone to anyone else, they would have said, well, it's been past the 10 years, get them replaced. Why removal?
Removal, I knew if one set could cause it, why putting in another one? I had never, ever considered putting in more implants. That was not, they were going to be gone. That was, even if I had been younger. I'm older, so it didn't matter. But even if there was never a chance that anything was going to be put back in my body.
Wow, very, very good. Now, next question, what and how were you hurting? What were your symptoms before the surgery?
I had shooting pains in my legs. I had really difficulty with my hands. Every morning I would get up, they would be totally stiff and hurting. It took a long time. I have a trigger finger developing in my middle finger, which has totally gone away since that's the one thing that's resolved since in 3 weeks. I could not be knitting because of the trigger finger. And I have noticed that the pains that I'm having in my legs and feet are totally diminished. They're not gone, but I would say
How much improved?
About 50% improved.
Oh,
in
so
3
that is
weeks.
significant. Now, could it be a coincidence? Maybe it's the nice weather here in Michigan and warm weather, or
no, I don't think so. I think it is my body is cleansing, and I'm trying to eat healthy, good foods and everything to get all of this system. I recognize it's going to take a while to get all of this out of my system. It's not going to happen overnight.
Yes, it took you some time to get here, and certainly, as you can see, the improvement certainly is very much there. The hallmark feature of breast implant illness are the rheumatological joint problems, that fatigue and all that, connective tissue problems, and you certainly improved. Now, let me ask you this overall, subjectively. How much improved are you? 30%, 40, 50, 60? How much, what percentage
I
improvement?
would say 3 weeks out, I'm about 50% improved.
Okay, very good.
In most areas. The only area that's not 50% is the dry mouth and the dry eyes. Other than that, that was probably, it's pretty, with sleeping at night, I have to get out and use the mouthwash because I have such a dry mouth. But I'm hoping with time that will drastically improve too.
Yes, no, we will continue to follow you. And what would you like to say to the 22-year-old college student who is considering silicone implants, or to the other patients who are, feeling the hurt, if you will? What would you say to them in regards to the breast implants?
Never, ever get any breast implants. Doesn't matter whether they're silicone or saline or anything. And if you have them, get them out immediately, because it will affect your health. If it's not affecting it now, it will eventually affect your health. And you may not even relate it. No one's going to tell you that this could affect your health. I was never told. I was never ever told they needed to be replaced after a certain amount of time. I had no clue about this. I thought it was a lifetime thing. So I never ever. Your body's perfect as it is, as the way you were made. You don't need any enhancements whatsoever.
I will tell you, you have such strong words of wisdom, and I could not agree with you more. Do no harm. Ultimately, sooner or later, it's like playing musical chairs. Your time will be up, be it like in the first 5 years, 10 years, 15 years. Yesterday, I did 2 cases. Both ladies, both of them ruptured implants.
Ooh.
One had implants from 2010, just 15 years old. Both of them were ruptured. And another lady, 74, 4 years younger than you, implants from 1982, and both were ruptured. And this is where the hurt will come sooner or later, not be it the ruptured implant, be it the breast implant illness symptoms, be it that very, very rare lymphoma. Ultimately, no one walks into my clinic saying, oh, the implants are making me think better, I can jump higher, I'm smarter. If anything, they're related to quote-unquote badness. You had what was a double bubble deformity as well, and I see your aesthetic contour of the breast. I'm very pleased, very happy. And, you've inspired me how active you are, as a physician. And, you've run marathons. You're like a full, determined, strong-willed lady. This is how active everyone should be. The way I look at you, you obviously have the good genes, but you've definitely taken care of your body. You are what you eat, and diet and exercise certainly go a long way, and you have definitely demonstrated that from the few times that I've talked to you. Anything you want to say to anyone who's listening?
Yeah, the first thing is reinforce. You are made perfectly, just the way you are. And if you want improvements in your body, do it with food, with exercise, with activity, with everything else. But never, ever, ever, ever consider breast implants. They're just toxic. Putting toxins in your body is never good, and never, ever even consider it.
No, thank you very much. Strong message. Thank you very much for sharing your journey.